we are requesting you to inaugurate this webinar series as well as our Foundation Day celebration, sir.
Thank you, everybody, and all the IPS KC dignitaries, the president-elect, and all the other dignitaries on the dais. Past president, my beloved Colgate Smile, Dr. Ajit Bhide sir, and the stalwarts of IPS KC. Am I audible?
Yes, yes.
Now, I congratulate IPS KC for commemorating the first IPS Foundation Day. And as has been said historically, this is a very important day, and it has been, I am thankful to all the zonal and state branches, as well as local branches and institutes and hospitals to take this what you call Foundation Day function forward, and it has now been extended because of the heavy demand that it should be extended to a Foundation Day week. So we are commemorating this day and celebrating our first IPS Foundation Day with great fan and fervor. Now, all the historical details have been told, and about the theme of this is that mental health matters, and that we know that mental health matters, but actually the public at large, as well as the people who matter in the higher echelons, like the politicians, like the bureaucrats and other people. So we will have to take this to masses as well as to people at the higher level, so that there are at present 2 or 3 goals. First is that, can we take common mental health disorders like anxiety, depression, and common addictions like tobacco, alcohol to the level of public health platform? And WPA says public mental health platform, like that of anemia, diabetes, and hypertension. Because these common mental disorders, common addictive disorders are also treatable, and especially the addictive disorders are preventable to some extent. So we should be talking about all these things as well as other mental disorders in great detail, and what we want is that media, social media, print media, electronic media should know about all these things, and there should be greater awareness and advocacy for this theme. And every year the theme will change, and people will talk about it in all the possible platforms, and then that theme will culminate into the IPS Foundation Day. And when all the proceedings will be published and they will be put on websites, as well as let us see if it is found suitable and there are scientific documentations, then we can also request our editor of IJP to come out with a special supplement for the IPS theme, or at least a guest editorial kind of a thing for the theme of that year. So that is our aim. So first is to take the common mental problems to public health platform. And the second, of course, is because of paucity of mental health professionals, what we are advocating from quite some time now with the NMC and with the government of health and family welfare, that make what you call psychiatry as a UG subject. We had a talk in greater detail with our past president, Dr. Ajit Bhide sir, and so we will have to move forward. And because we are having 9,000 psychiatrists only in the country, and very less other mental health professionals like clinical psychologists or psychiatric social workers or psychiatric nurses. So we will request also to the government that besides making psychiatry as a UG subject, to make psychiatry as make individual psychiatry departments in all the medical colleges, and start MD psychiatric course also, because the data which I am having is that out of 554 medical colleges, currently 234 medical colleges are only running MD psychiatry course. There is also an opening in that through diplomat, that is national board, there are some 8 diplomas have been started in different disciplines, like maybe anesthesia, pediatrics, gynae, radiology, etc. So we would like to urge to the government to put psychiatry as a 9th diploma subject, so that in-service candidates can get benefited by that diploma and can serve the public at large. As well as the mental hospitals also should be converted into the teaching hospitals, teaching institutions. Like in our state, Agra has been converted into a teaching institution and MD seats have been there. And so this way, if all the 43 odd mental hospitals can be converted, in South, I believe there are, but in other states, there are very few. So it is required. That is also a thrust area, and by which we will be able to make some improvement as far as the ratio of the presence of mental health professionals. So these are some of the ideas with which we should proceed. And I am also happy to tell you that our IPS ethics committee is also formed, and we will proceed with that further. And Gautam Saha will take that to greater heights, in which we will be starting certain courses, training courses also, for even for medical as well as paramedical people. So with that, I once again congratulate all of you and thank you for having me in your IPS KC as a chief guest, and my best wishes to all of you. Thank you, one and all.
You unmute. You have to unmute. So please unmute.
Thank you, Dr. Dalal sir. Who has narrated about the importance of making advocacy as well as creating awareness about the mental health in the community, as well as the need for more and more psychiatry PG courses in the community, which are very, very essential, and which is a beginning, which will be a good beginning through this Foundation Day celebration. Thank you, sir. So now may I request our President-elect, sir, Dr. Gautam Sahaji, to speak a few words, sir.
Thank you. Good evening, ladies and gentlemen. My dear friends, at the outset, my pranam to Dr. Venkat Ramaiah, the stalwart of our fraternity, my president of Indian Psychiatric Society, Dr. P.K. Dalal, secretary, the dynamic person like Dr. T.S.S. Rao, president of Hello, Dr. Sripati M. Bhatt, the president of the state, Dr. P.K. Kiran Kumar, the president-elect, and the secretary is Shoma Shekhar Bijjal. And the other dignitaries like our past president, Dr. Ajit Vide, the president of the South Zone, Dr. Ramkrishnan, senior member, the past president of South Zone is Dr. A. Jagadisha, and all the senior members and my dear friends and junior brothers and sisters. You know that today what Karnataka chapter of Indian Psychiatric Society has chosen, the theme is revising revelations in mental health. It is a fantastic initiative. In fact, this is how we should know how to respect, honor our senior members of our fraternities. And by this program, we can convey to our junior colleagues this, and their contribution encourages us how to proceed the Indian Psychiatric Society in future. As history said by our president and also Dr. Sripati, the president of the Karnataka chapter, Indian Psychiatric Society, and also the secretary explained that and narrated that how the Indian Psychiatric Society started its history in 1947. Only 15 members were there. Now it is more than 7,500. It is a great achievement. We work on health advocacy, social activism, policy formulation, and medical research in the field of mental health. There are almost 33 zones and branches. And if you see, we are not working on the area of the patient, on the people with mental illness, ill. We also work and we do safeguard of interest of psychiatrists and the fellow professional in India. We had a different contribution in the field of mental health on behalf of Indian Psychiatric Society, like we had active role in Mental Health Care Bill 2017. We have given different position statements from Indian Psychiatric Society, like from ECT to LGBT and all, using of OST and different angle, even in the stem cell therapy. We took a lead role in undergraduate course. We have developed clinical practice guidelines, which definitely helps our Indian psychiatrists, especially, and also international, when the research works, they want to do it in perspective of the socio-cultural background of India. And there are lots of publications. If you see through our Indian Journal of Psychiatry, you can find it out. And lastly, again, I must thank to Karnataka chapter of the Indian Psychiatric Society for organizing such an excellent event and take a great initiative. And this year, what is the Foundation Day of Indian Psychiatric Society? It was actually the brainchild of our president, Dr. P.K. Dalal. And it was observed fantastically throughout the India. It is a huge success. Next year is the 75th celebration. It will be 75th celebration of Indian Foundation Day. I hope this year we are restricted to our fraternity, but next year we go to the road. We will involve the society at large as well. Thank you. Thank you so much for giving me this honor today. And hope all the best, because Karnataka branch is one of the most important and most active branch of the Indian Psychiatric Society. After joining in Indian Psychiatric Society, I have seen so many times they are the best branch in Indian Psychiatric Society. Not only that, the mother institution of Psychiatrists of India is NIMHANS. It is situated in Karnataka only. So we hope we all work together and Karnataka chapter will do much more, contribute much more in the Indian Psychiatric Society. Thank you. Thank you so much.
Thank you very much, sir. Dr. Gautam Sahaji, sir. You have again, once again, you have narrated the whole story of how IPS, Indian Psychiatric Society, from the last olden era to the new era of ECT, LGBT, how it has progressed, and how it has communicated, created awareness in the public, general public. You have given a very good address, sir. Thank you very much, sir. I welcome our South Zone President, sir, Dr. Ramakrishnan, sir, to this function, sir. Welcome, sir. On behalf of IPSKC, I will welcome, sir. Now I request our past President, Dr. Ajit Bide, sir, to give his address on this program, sir.
Thank you, sir. Mr. President, Dr. Sripati Bhatt, this is a Karnataka Psychiatric IPS Karnataka branch. I start with you.
Yes,
but I hearty welcome to our premises and our state branch, our national president, Dr. Dalal, Dr. Gautam Saha, our president-elect, TSS Rao, I don't know whether to welcome you to your home ground, Dr. Ramakrishna, South Zone President, my dear teacher and today's celebrity, stalwart, Professor VVR, Dr. Jagdish, past President of IPS Karnataka and past President of IPS South Zone, Dr. Jagdish, all other dignitaries, please forgive me if I've missed a few names. It was very nice to hear from Som himself and then a reiteration by dear friend Gautam about how the IPS came about with just 15 members. Actually, there were 4 members who first floated this idea, and how from the Indian Science Congress, we came down to found the Indian Psychiatric Society. And we must remember one man who struggled night and day, though he was not Indian by birth, to get the Indian Psychiatric Society going. That is Major R.B. Davis, who is well reputed and well respected across the country, but many of the younger people may not be aware that this Irish-Scottish gentleman who was in the British Indian Army was the one who was very, very determined that this society should be founded. It isn't as though if Dr. Davis had not been there, it would not have come about, but he was the one who, and Dr. Day, who was our founding editor, these two gentlemen really they worked hard. I won't say they struggled because they got a lot of support. There were only about, I'm told, 35 psychiatrists across the country. So if 15 met and started the society, it's no mean achievement. It's it's something worth recalling. More recently, we ought to remember my predecessor as the president of the Indian Psychiatric Society, who traced the registration of the Indian Psychiatric Society more than anybody else. That is Brigadier MSVK Raju. I know that he went about assiduously finding this out, and he was the one who said that he unearthed what had been lost facts. That it was in Patna that this society really started and it had to be registered. And then, during my tenure, the secretary, Dr. Vinay Kumar, who fortunately for us is from Patna, followed this up, traced out the registration. And fortunately for us, his brother-in-law is a bureaucrat who could get us to renew our registration as a society. These little nuggets, I think the younger people ought to know. Tomorrow you are going to be at the helm of the society, and you should be aware of these many facts. My interest in the Indian Psychiatric Society started with my first professor, Dr. H.S. Subramaniam, who had a tenure as the secretary of the Indian Psychiatric Society. And through him, because I was his, not even a qualified postgraduate, but his protege in a sense, I used to go around him and met many great people, including Dr. A. Venkova Rao, who had just finished his tenure as president of the IPS, and many other great stalwarts. We have now reached a stage where we have great awareness about mental health more than it had been. Even now it is perhaps inadequate. But I have a little bit of a fear that we might err on the side of overselling the theme. We have the World Federation of Mental Health, which really gave the idea of celebrating the World Mental Health Day, and the WHO was quick to accept this proposal. And we have a theme for the World Mental Health Day, which is still given by the World Federation of Mental Health. I propose to, especially Dr. Dalal, our president, and Gautam, our very endearing, simple, straightforward vice president, soon to be president, to have a theme for the Foundation Day, which will be different from the World Mental Health Day. Have a theme, and across the country, let that theme be popularized, accepted, and each year you have one theme for the Foundation Day. Otherwise, our Foundation Day will get a little diluted and a little too diverse. So I urge you to have a theme for let the president of the year decide the theme for the Foundation Day, and that will be observed. It will be different from the World Mental Health Day theme given by the World Federation for Mental Health. So, Dr. Venkatramaya, it is an honor to have you with us. And I'll tell you, this man, along with Dr. SMC, who is no more, Dr. SM Chennapaswanna, these people never stood on their ranks. Whatever our functions are, they were always there. There are a number of other senior professors, I will not take names, who came if it was convenient, or if they were being honored, or if they were being, but VVR and SMC were two people who attended all our functions without fail, and they never stood on their seniority. This is a truly remarkable gesture. In fact, I have not heard Dr. VVR speak since he was felicitated as the Distinguished Psychiatrist of the Year. And I look forward to the idea that you should be the person today was Dr. Raghuram's, quickly endorsed by me. And I was the one who suggested Dr. Jagdish is the right person to interview you. So I look forward to the talk of your experience with psychiatry in general and NIMHANS and IPS in particular as we go along with today's function. Dr. Ramakrishna, it's a pleasure to have you with us, and we look forward to your patronage of not only IPS South Zone, but also IPS Karnataka. You have always been a great friend of Karnataka, and you have still not done the little thing I asked you to do. I hope you will do it soon. This is strictly between you and me, but I'm saying it in a public forum in order that you may be alerted to do it, to fulfill my request to you. I thank you, Professor Sripati Bhatt and Dr. Somsekhar Bijal, for giving me the opportunity to be here. I'm looking forward to the day when the Foundation Day is thematically uniform across the country, and may we remember not only our Foundation Day, but also the great people who were our founders. Thank you very much.
Thank you, Bide sir. Definitely your suggestions are well taken, sir, which need to be, because mental health themes which are maybe suits other countries, but one Indian-based mental theme which should be there so that we can create more awareness in the community. Definitely, it will help, sir. Thank you very much, sir. May I request now our South Zone President, Dr. Ramakrishnan, sir, to speak few words.
Good evening to all of you. Respected President of IPS Karnataka, Secretary Dr. Bijal, all dignitaries, Dr. Bide, Dr. TSS Rao, our President of IPS, Dr. Dalal, and Dr. Gautam Saha. It is a pleasure to be among you now. I am very fortunate on this day of celebrating the Foundation Day. I am fortunate to be along with you, all stalwarts. I am very proud, and I am also very happy that we are with the senior most psychiatrist among India. He's here, and I am thankful for Karnataka for giving me an opportunity to talk to you. I very appreciate the way the Karnataka has started this Foundation Day with a community awareness program. Dr. Bijal, you should hats off to you. You started with a community program, and all my medical colleges in Karnataka believe they celebrated and awareness program was there. See, ultimately, the very purpose of this Foundation Day or any special day is to take our message to the public. That is what our motto, everything is. And you have proved by your work, sir. Hearty congratulations to you. And I hope this new venture of interviewing stalwarts in psychiatry and putting across in the YouTube is a very good one. And I think we can learn a lot from our seniors. I've been keeping on telling that education is one thing, practice is another thing. Success is not determined by your qualification and your knowledge, but it is how you relate to the society, how you respect your seniors, how do you take leadership. These are the things that are going to determine your success. See, Dr. Gautam Saha is now the youngest president of IPS. That because he has taken up this spirit of leadership from the beginning. So that's why he is successful. So this type of mantra should spread across to the younger generation. Younger generation people should know all these things. They should know the history. They should know the suffering what we have undergone. They should understand what are the things which we have to communicate to the public, and they have to take some community activity. Every psychiatrist should be community oriented psychiatrist. Then only the treatment gap will come down, or else no point in keep on talking among ourselves is not going to build anything. Still the treatment gap is 90%. See that 90% at least every year as a psychiatrist fraternity, as an association, we are able to reduce 2% of treatment gap every year over a period of maybe one decade, 2030, we will reduce the treatment gap by at least 80% to 75%. Then the success is ours. I take this request to spread across to all psychiatrist association members to take up this very seriously, as Dr. Ajit Bide was telling, have a unique theme for every year, which will be public sector. So we can do much more. And I promise that I will be a soldier till my end to IPS. Thank you. Whatever work you want me, I will do it, sir. This is my humble promise. Thank you, sir, for giving me this opportunity.
Thank you, Ramakrishnan sir, for your kind words, and also telling us the importance of Guru Chela relationship, and which our Indian culture has followed so many days, sir. And also your last words, till death you will be the soldier for IPS. Thank you, sir. We follow your words, and we also be the soldiers till our death for our IPS. May I request now our Honorary General Secretary of Indian Psychiatric Society, Dr. TSS Rao, to speak few words, sir.
Thank you very much, Dr. Bijal, for this extraordinary great opportunity. And I thank God for this opportunity of being host and guest together is something quite. Dr. Dalal, Dr. Gautam Saab, and Dr. Ramakrishna, Sripati Bhatt. IPS Foundation is one of the, I think, master stroke that happened in the sense that I'm having the report almost from a majority of the zones, many state branches, local branches, individuals, hospitals, and in fact, they have taken it in such a great spirit. I'm really overwhelmed, and I request each and everyone to take some photographs, report it, and we need to document it in a proper way. And that is one of the promise actually from our side. Of course, this particular occasion, I'm seeing there are about 4 people I'm very, very closely associated. I was posted in National Institute of Mental and Neurosciences as a junior PG. And the first teacher under whom I worked was Dr. V. Venkatramaya. In fact, I know him almost now 42 years. The second, my contemporary is there, Dr. Ajit Bide. Dr. Sripati Bhatt was 2 years senior to me. And in fact, the early steps, what I have taken in psychiatry, the credit goes to. And Dr. Kiran Kumar was my student taking up as incoming president. And what else I can ask for actually? In fact, this is something extraordinary occasion for me at the outset. Indian Psychiatric Society, Karnataka State branch has almost always been in the forefront, coming out with extraordinary great ideas, novel ideas, creative ideas, and some of those things which have turned out to be mandatory activities. I think that's one which is bringing all the glory to the branch. And each and everyone has struggled hard to see that these are all implemented in a great gusto. And in fact, that's what actually we are seeing the results. I won't take much time. Dr. V. Venkatramaya, Dr. Ajit Bide made the point very simply clear that almost every conference and meetings we used to have him. And I can tell you, more than 15 major conferences, what I have heard, the first call used to be from Dr. V. Venkatramaya. Rao, how are the things? And my best wishes for you. And he was there. In fact, he's so simple and humble that he never asked for anything special requests. He used to come, stay all through and guide us and help us. And this is what actually Dr. V. Venkatramaya is about. And that only shows being humble, in fact, enhances the personality in a very big way. And these are the personalities what people try to emulate. And he's one of the classic example, what Dr. Ramakrishna was mentioning. Ultimately, when somebody is successful or not, and ultimately somebody is remembered or not, depends on not on how many degrees and how many papers he has published, but on how he has mixed with people. So from that particular angle, hats off to you, sir, and I bow my head to you for that you made me psychiatrist, and we are here to see that what you taught us is implemented in the best possible way. And this initiative that every year, every month to have some programs and recognize stalwarts and bring into the focus. I still remember I was examiner in Chennai, and one of the students we were asking who is one of the person who has done great work. We wanted to hear some particular Venko Brau or something like that. But when we mentioned the name Venko Brau, that candidate was not able to tell. We were really surprised, and that's the time we brought out a special supplement called as Icons of Indian Psychiatry, which is a supplement available in the archives of Indian Psychiatric Society. And that time onwards, I realized that unless we talk about it, unless we document and publicly, in fact, bring it to the focus, people will forget how actually this particular society came into being and how it has actually grown both at state, national level, and internationally. We'll forget. With these few words, I won't take much time because already we are running out of time. I can understand that. I wish this program all the success, and I am really sorry that I was not able to make it personally there. I was traveling last 2.5 days continuously, and this suddenly came up, and there were too many other things, including, more importantly, was the audit which was going on for our research activities, what we do in our department. That's why I missed it. Sorry for that. I wish this program all the best, and I'm more than confident that it will be one of the very great successes of IPSKC. Thank you very much.
Thank you very much, sir, for your kind words as well as the inspiring words for our society, sir. Now, I would like to tell you that from Karnataka, two dignitaries have chaired the Indian Psychiatric Society chairmanship. One was late Dr. S.M. Channabasavanda, sir, and second one is our, as everybody says, Colgate man, Dr. Ajit Bide, sir. And also IPS, yes, IPS South Zone, around 8 to 9 people have chaired the president, sir. One is, I remember.
So just 1 minute. We have to remember Dr. S.S. Jairam. Okay. Dr. S.S. Jairam was treasurer of IPS at the national level, and later the president of the IPS at the national level.
Yes, yes. And we had South Zone also. There are many people who have represented from Karnataka. To, as I remember, and as the information what I got from our colleagues, that one is Dr. S.S. Jairam, sir, Dr. K.N. Srinivas, sir, Dr. B. Jairamaya, sir, Dr. Kalyana Sundaram, Dr. Prakash Appaya, Dr. Mohan K. Isaac, Dr. Ajit Bide, Dr. T.S.S. Rao, Dr. Swaminath Ji, and Dr. Jagadish Iyer. So we are proud to have them as our IPSKC members. We have made significant contribution to not only to the state branch, zonal branch, as well as to the Indian Psychiatric Society at the national level. So we are proud of you, sir. And this is the moment. This is the Foundation Day is the place where we need to remember your contribution. We'd like to honor you. There are few presidents, past presidents. We are in person. We are honoring them after this event. And those who are in not virtually joined us, definitely we will be honoring them in the next consecutive program, sir. So I thank on behalf of IPSKC all our past presidents of IPSKC, IPS South Zone, and Indian Psychiatric Society at national level. Now, after the vote of thanks, the today's program, the launch, interview of the first stalwarts will start. Now I request Dr. PK Kiran Kumar to give a brief vote of thanks, which will be followed by the interviewing of the Dr. Jairamaya sir by, Dr. Venkatramaya sir by Dr. Jagdisha sir. Dr. Kiran? Dr. PK? Our Vice President, Dr. PK Kiran Kumar? I think he's unable to join currently. I would like to, on behalf of Indian Psychiatric Society, I would like to thank our National President, Dr. PK Dalal, who has inaugurated this Foundation Day celebration, as well as launched our new program, the Revising Revelations in the Mental Health. And I also thank Dr. Gautam Sahaji, President-elect, our past President, Dr. Ajit Bide sir, and our South Zone President, Dr. Ramakrishnan sir, our Honorary Secretary, Dr. TSS Rao, and our President, Dr. Sripati Bhatt, and Vice President, Dr. PK Kiran Kumar, and all the members who are attended in person, as well as the who are attended virtually. Now I request, and also I thank the supporters of, the sponsors of this program, Micro Labs, as well as the Telearogya team. Now I request Dr. Jagdisha sir to start this month's stalwart, Dr. Venkatramaya sir's interview, sir. Over to Dr. Jagdisha sir.
Thank you, Dr. Somsekhar Bijal. It's a great initiative by our young, dynamic General Secretary and President, Dr. Sripati Bhatt of Indian Psychiatric Society, Karnataka chapter. Thanks for Dr. Dalal, President, and our President-elect, Dr. Gautam Saha, to give their blessings on this occasion. As usual, our own people, Dr. Ajit Bide has given the right introduction. TSS Rao, Dr. Ramakrishnan is with us, and nice to see that Dr. Gautam Saha is also here. Today, rightly, this Karnataka chapter has selected a right person to start with as a stalwart to speak about psychiatry. Indian Psychiatric Society, the people, Karnataka, Indian Psychiatric Society, Karnataka chapter has produced stalwarts like Dr. S.S. Jairam, Dr. H.S. Subramaniam, Dr. R.L. Kapoor, Dr. Chanbaswara, etc. Today, we have a living legend at the age of 86. We are very proud to state that he is a Bangalorean, born in Bangalore, living in Bangalore, and living healthily in Bangalore. None other than Professor V. Venkatramaya. Dr. Venkatramaya was born in Bangalore on 15th March 1934. He had father, Dr. Mr. Venkatraman, was an agriculturist, and mother Rangamma. Because he lost his parents at a very young age, he was brought up by his maternal uncle, whom he is going to speak about later on. He had his early education in Bangalore, college at Mysore. Then he joined MBBS at Mysore Medical College in the year 1952, completed his course in 1957. After 2 years, 1959, he came to NIMHANS, what was earlier mental hospital, Mysore Mental Hospital, Bangalore, and joined TPM in the year 1959 and completed the course in 62. Not that he did not pass, he took 1 year break and completed the course. Later on, he went on to do MD Medicine from Bangalore Medical College. Between 1963 to 65, he did MD Medicine. So we have two legends who did psychiatry and medicine, Dr. Chanbaswara and Dr. Venkatramaya. Dr. Venkatramaya, after completing his MD Medicine, joined NIMHANS as assistant professor and a faculty in the year 1965. So immediately after completing his MD Medicine, he joined NIMHANS as a faculty in the year 1965. Till 1980, he was associate assistant professor and RMO of the mental hospital. Later on, from 80 to 89 as a professional career, he was the superintendent, professor, head of department of Dharwad Mental Hospital, and professor and head of department of psychiatry, Karnataka Medical College, what we call KIMS today, at Hubli. After his retirement, Dr. Venkatramaya continues to teach in MS Ramaya Medical College from 89 to 95, and later as a professor head of department, later on shifted to Ambedkar Medical College and continued to be professor and head till 2001. After that, he has taken the backbench. What is the secret of Dr. Venkatramaya being so alert and etc.? I'll give 1 minute introduction and then I will hand over the mic to him. Dr. Venkatramaya, or I'll tell, got married in the year of 1961. Mrs. Sharada, housewife, and he's blessed with a daughter and son. Both are in Bangalore, and a very happy man living with his son, daughter-in-law, and grandchildren. It's over to our time, Dr. V. Venkatramaya. Namaskara, sir. Today, in the first series, we are honored to have Dr. Venkatramaya as our guest in the first program. So I would like to request Dr. Venkatramaya. In those days, people were hesitant to go to mental hospital, even to work as doctors. What made you to take up psychiatry as a profession, sir?
Thank you, Dr. Jagdish, for giving me an opportunity to associate with you all. It's kind of you having spoken much about me. What I feel, certainly, as you wanted to know about why I took up psychiatry. Actually, earlier, most of the people shun psychiatry. While I was also not fully interested in psychiatry, what happened after passing MBBS, I took up work at ESI hospital, ESI scheme. There it was a sort of a mechanical work, and I thought I would be wasting my time working there. And I was interested in taking up some post-graduation, and change my career. Incidentally, what happened, there was in, say, 58, there was no postgraduate courses anywhere in Karnataka except the then All India Institute of Mental Health. So there was no other option other than joining this institute. And then, of course, the step by step I came up. And then my idea, whether it was demands or others, I was more interested in service than academic activities. So you might have seen I had produced very less research papers, but out of heart, I am very happy that I could help so many poor people, and my services have extended to all other also. So this is how it happened that moreover, my uncle who brought me up, Dr. N.V. Raman, he was working earlier for some time at mental hospital, Bangalore, as a hematologist there. And I was living with him. And I knew, I was fairly familiar with the institute, that is All India Institute of Mental Health. So I could get seat. Moreover, Karnataka being the leader there, and it was associated with Bangalore Mental Hospital. Karnataka was allotted 6 DPM seats for the course, while the other parts of India and also it had reputation over other parts of Asia, and at one time there were quite a number of international students and then interstate students also at All India Institute of Mental Health. This when that was there, so
You had international students studying along with you from Asian countries.
Asian countries
Yes.
like Burma, Ceylon, Malaysia, and Thailand, and all that. Both for psychiatry, also for nursing.
Thank you, sir. You were associated with NIMHANS for over 2 decades. Can you just tell me what are the highlights of what you did at NIMHANS in the last 2 decades, from 62 to 80? You entered there in 59. In 1980, you continued to work there. Can you just tell us how did you enjoy working? What are the highlights of it?
Earlier, my transfer to Bangalore, though was the best hospital in India, but the patients there were sadly very deteriorated and miserable. So, service was more important than the other activities. I was mainly, as I said, concerned with service of these people. I once in 62 when I joined the hospital as a stent surgeon, there were nearly 700 patients, and there were very few qualified doctors then. I was the one, and then there was Dr. Swarman. We were two at that stage, and I was looking after the male side, which was having nearly 400 patients, and on the female side, that's 300 and odd patients. Actually, we were doing alternate days outpatient and alternate days night duty, like that. So we were fully engaged because the paucity of qualified people, even though the All India Institute of Mental Health existed there. So somehow we carried on. Then the very next year, that is 63, some more batch from the other batch students who qualified DPM joined us, and that was a great relief. Then the conditions slowly improved as qualified people came. Some treatment was given. So at that time, not many drugs were there. Dopamine was the sheet anchor, and DCT was another sheet anchor of treatment. In addition, there were insulin chemotherapy units, and earlier, Dr. Govind Swami used to do leucotomies for many of the disturbed patients who were otherwise not manageable. So this was all the armamentarium we had then. And as we started giving attention to these people, and then we started rehabilitation program.
You are considered to be one of the founding father of rehabilitation at NIMHANS. Today, it has become one of the big subspecialty of psychiatry. Can you share us some experience about how you started that rehabilitation work at NIMHANS? It is popularly called as Pandey therapy in Kannada. In English, it is called rock therapy.
Thank you for reminding me about this one. Uh, before that, anyway, this Pandey therapy or Pandey therapy was because the hospital was overcrowded and with all that disturbed patients and all that, it was dirty. So to clean up the hospital, these patients were taken to the hillock nearby. That is where now neurology section stands. There was a small hillock there. So these patients were taken there and allowed to bask in the sun and then brought back for lunch. Meanwhile, because many of these patients were disturbed, destructive, and they used to tear off their clothes and all that. There was an ingenious substitute for that. Perhaps you've seen the gunny bags. These gunny bags were inexpensive, and then they used to make two bottom ends for 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 arms, and then one central hole was made for the head, and this one was just like a gown. Put, it was like a gown, more or less, and this was the attire for many of these disturbed patients. So these patients were also taken to the Pandey therapy, as Dr. Jagdish pointed out. And there were children from the staff who used to see these people, and they used to call this as gunny bag troop. This was the state of affairs in demand, or rather, in the All India Institute of Mental Health. But as things, more doctors came in, and then they started treating them
Better.
Things became better.
Sir, in those days, one of the commonest problem apart from psychosis was hysteria. And I learned that Dr. Venkatramaya was running that hysteria clinic. Can you share some experience about running that hysteria clinic, sir?
See, amongst the psychiatric problems, hysteria was one. And what I had the experience is, it is quite easily treatable, and you can give a cure for it, provided you follow the path of exploring and path of giving psychotherapy and all. So, what happened? Hysteria clinic, otherwise, people used to mistake them for physical disorders, and as they couldn't succeed, then somehow they were referred to this mental hospital. Then to give special attention to these people and to work work out on these people, we have started a hysteria clinic. Even most of the patients who were attending the neurology section for some of these ailments, they used to refer to hysteria clinic for treatment. We generally used to take good history, explore the psychodynamics by either interview or by using Metathal interview, where these people were not coming out with proper psychodynamics. And once we started to know the psychodynamics. Then we used to take them up on psychotherapy and they used to be cured.
This possession syndrome also, you had a special clinic or they were seen in the same hysteria clinic, sir?
See, what happened? Uh, there was a school near Hungary. This school, boys, while they were standing for prayer, some of them used to fall down, pain and unconsciousness, and they
Mass
used
hysteria. Mass hysteria.
mass, you can say mass hysteria, but they used to mutter something during their so-called unconscious state, like I am a Ganam, that is a demigod, and then I want this, I want that, like that. They used to make demands. Actually, this calling unconscious condition, the school tried various techniques and then they were not successful. Then they contacted demand and
Those people were taken care.
no, uh, and then I was sent to that school to assess the problem. And when I found these people are feeling unconscious and also muttering something that they are and all that, it's a sort of possession state. But actually, this made me think this is another reflection of the society there. And in the society there, most of the women used to get possessed. So these children having seen that and they were
They were
trying to imitate
the ladies. Sir, working at demands in those days or a mental hospital, there was no other stimulation like what we have today. Did you have any extracurricular activity which you started or did there, sir?
So actually, I was interested in sports particularly, and first the tennis court at Demand was idling, and then I started getting it done. Fortunately, Dr. Narayan Reddy was also interested in tennis. He invariably used to ask me to do something about it. So we started playing tennis, and particularly Dr. Reddy used to call me in the morning. I was there in the quarters then. So he used to call me that he would be coming, and then I used to wait. I was at the other end of the quarters, and then we used to play. Then Dr. Vidyasagar and the administrative officer all used to play. Quite a number of students also used to join.
For playing.
Play.
Sir, you started playing tennis in 60s. And one of the secrets of looking young and both physically and mentally, the one thing for youngsters you have to tell till 2018, that's around 58 years you played tennis. Can you tell something, any moments which you remember about playing tennis for 58 years? Now, till 2018, Dr. Venkatramaya was playing tennis. That means till the age of 84. One word about that.
No, because I was interested in tennis. That's the main thing. And in the earlier days, I was physically very active. Of course, earlier days we used to play cricket. And then also I was in scouting. In scouting, I used to, we called a rover, and we had to go around. And in fact, in Mysore, when I was student in the high school. Myself and the other we walked all the way from Mysore to Srinagar, then went to one place called Gosaigata in Srinagar. We swam in the river, then we cooked our food there, ate, and then came back like this. We
So
were
from the
physically very
beginning,
active right from the beginning.
from the beginning, you had interest in all extracurricular activities.
That's true.
Am I right, sir?
Yes.
Now, that's a message for youngsters to remain young and energetic. One should have some extracurricular activities like some sports. Now, in 1980, you were sent to Dharwad Mental Hospital. And you know, today demands is in a big place. They have a lot of funds, etc. What's your experience of working there for a decade at Dharwad Mental Hospital, sir?
See, the Dharwad Mental Hospital was in a worse state. It was when I went there, it was already under 45 years old. Many of the wards were dilapidated and some were collapsing. And the patient's condition, of course, as I said about Bangalore Mental Hospital, same thing was there, but this was in a worse condition. In addition, there was no funds for improvement. Yeah, it was a neglected institution. So nothing could be done. And in addition, the staff there were alcoholics, and they were a big problem. They used to somehow catch hold of the relatives of the patients that were brought for admission, extract money from them, go drink and make unruly scenes outside. And also their work was disrupted like this. So I planned reformation of the institute without any contribution from government. One first thing was I had to tackle the alcoholics. I planned phase-wise improvement. So first phase was one of the first phase was to see that these alcoholics are rectified. So I initially requested them to give up and all that, but that didn't work. Then I wanted to threaten them that if I started issuing memos and all that, and threatened them that I will dismiss them. Then they came round, and then I started anti-abuse therapy for them. Earlier, nursing superintendent used to give the tablets, but they were not taking. They used to spit it out. Then I called them. Then I used to give tablets in my presence. See that they swallow, and this went on. And surprisingly, there was a tremendous change in them.
After they gave up alcohol, they were working better, and the institution also started improving, sir.
Institution also started improving. Then they were cooperative also. They used to take care of the patients. Ultimately, I wanted them to take care of the patients. Next phase, I wanted to train them modern. They were rude.
So you wanted to change their conduct and behavior, which happened.
So they were given in-service training and teaching.
In those today, there is every department has HR to train. In those days, you were one in all. So you were training them about how to conduct, behave, and all those.
And how to handle patients, escort patients, suicidal patients, like that. And after that, I wanted to assess the disabilities of all the patients. So there was only one clinical psychologist.
So did you train these people to assess?
Exactly, exactly. Particularly nursing staff.
You train the nurses
And
to
train
assess the patients.
And after this, after training this one, and also after assessing the disabilities, we, as a psychologist myself, put them into two groups with severe disability and moderate disability. Because the treatment approach has changed.
So you streamlined the management based on the severity of the illness. So you reformed the employees, you improved the quality of care, you also divided them and saw that such special attention is given to patients who require having severe symptoms. Apart from that, anything else, sir?
Exactly. The thing is, their wards were also segregated.
Okay.
Because the approach was different. In the sense, the severely ones, right from their personal hygiene, they have to maintain, and how they have to look after themselves, like that. Nurses were also trained there. So, and they were given instructions, and a timetable was made. At what time they have to get up.
So you prepared a schedule. You prepared a schedule of activity for them. Sir, in 10 years, did you find any improvement at the end of the day when you left the institute?
See, and also there was practically no automation. There was only one weaving and one tailoring machine. I went to industries. I went to Padi village industry. They gave charakas. And then I went to some of the industries. They used to give some simple training one. And in it, and ourselves, we went from the hospital itself, we were asked to make paper bags, paper covers, and then file making, and then chalk powder chalk piece making, then mat weaving, like this. We improved occupational therapy, and then there was a garden. So agriculturists were sent there, and they were doing gardening there. So all these activities came up, and then the surrounding was very gloomy. So I changed the surroundings by beautiful gardens, and invariably we used to get praises for the garden.
During the
The
Republic Day,
corporation.
Republic Day function. So you have the satisfaction that in one decade you were able to reform that institute to a greater extent.
Definitely. And then after 5 years, we reassessed.
Yes.
And the assessment showed significant change. There was 70% of
Improvement.
Were chronic. That came down to 30%. Like that. And the acute patients used to come take treatment, they go. There was a turnover of
So because of all these reforms, the patients were able to be discharged and you were able to.
And then there was, they were afraid of mental hospital people. And then to change their fears, what I did, in one mental health week was conducted. I invited.
So you created one awareness program for a week.
And then radio talks and all that were given that it is a treatable condition. And they used to see, and they were also, in fact, they used to threaten us that we will send you to Belgaum Road. So this was in Belgaum Road.
Correct.
You know, earlier in mental hospital Bangalore also,
Yeah.
they used to say, I will send you by route number 4. So like that.
So that was changed, sir.
And then
Attitude of the people changed.
Yes. And then I conducted an exhibition. I took articles from the pathology department of NIMHANS, brain sections and other things, and models of brain. And then, like this, charts were made. So, this I deliberately conducted this exhibition right inside mental.
Excellent. So you
So-
made public to come over and see
Exactly.
what exactly is happening in mental hospital.
So, we were overwhelmed with
The response by the
visitors,
people.
response, and we had to extend for another week or so.
I guess you had a wonderful time at Dharwad, sir.
Sure.
Where in one decade, at the end when you left, what satisfaction you had in one sentence? Can you tell us?
See, I'm satisfied by one thing. I could do good service, right, in demands also, and also Dharwad fully changed. So recreation therapy. So our staff and staff nurses and also student nurses used to come. They used to give entertainment program for them. I have focused on all that. I think I didn't bring it. Anyway, and a small temple was constructed.
Okay.
So here, some bhajans, pujas,
Used to happen.
took place because I wanted to have their cultural value to be retained. And then another thing, many of the female patients had lost touch with cooking. So I introduced cooking classes.
Okay.
So this cooking classes did wonderful work. One lady from was taken from Bombay because Dharwad was earlier in Bombay presidency, and this lady was sent to mental hospital in Dharwad. And she used to be secluded and then irritable, never took treatment. Somehow our nurses could coax her to join cooking. First, she reluctantly joined. Then she was very interested. They showed very much interest in it. And surprisingly, she was 100% normal.
So she recovered so well.
So well.
So that all the
Without,
fruits of what you did, like training the ward-wise, reforming them, improving the quality of care, hygiene, using their services, and establishing a novel way of engaging the patients in occupational therapy, beautifying the places. I guess you have wonderful memories of Dharwad.
Yes, sir. And also, we used to grow vegetables in our garden, and invariably they were. I used to see that they get good seeds and manure and all that. Invariably, they used to produce huge
Quantity of
vegetables, and we used to get prizes for that also. So this how I reformed that hospital.
So you feel very proud of reforming that institute.
But that was not recognized.
Absolutely true. The recognition comes to people who are close to politicians for state award, but not people who have worked behind the screen.
That's right.
Huh?
Perfectly right.
True.
And not even help the institution.
I'm
But,
extremely glad, sir,
But
today.
one thing, I had very good contact with public, and many of the officers of the state level, they were all very considerate. University, I could get anything done. Incidentally, DPM was started there.
When you were there.
I started there. Actually, beginning,
Yes.
though Swarna had made arrangements. Actually, it was started when I was there. And then that was another thing, another contribution, manpower. And of course, other teaching programs used to go on for nurses, undergraduates, and all that. So it was very active and regarding, I said, overcoming here, people used to bring children, school children, to show this to the hospital. Mostly they were afraid of it, but they used to. And during the Republic Day and Independence Day, I used to conduct sports meets for both and patients. And it was good. So even the students from school students from our surrounding area used to come see and all.
So you had a reformed the TV in 1 decade, and you have the
Without
satisfaction.
any funds from
Government.
government.
Without those days, not much of money given for those activities.
Exactly. Exactly. See, this is because of the 20 years of experience I gained in Reliance.
You could able to execute it that one.
So that all I could pour in there and get the results. That's so satisfying. And people were also happy. In fact, as I see many of the officers, they were used to oblige me. In
Probably
fact,
because of your honesty, simplicity, and very hardworking, might have made the government officials to see that whatever you ask in their limited these things, they used to help.
actually, Deputy Commissioner of Dharwad, once what happened, our pump set, we used to get water from big well there. That was damaged. And then we couldn't get it repaired. What PWD has to do, but they didn't do for paucity of funds. So this somehow DC came to know and contacted me. I went to him, told him of this. So he installed a borewell to supply water. And also, incidentally, I was surprised was he made an open ward. Hitherto, there was no open ward. So he constructed an open ward on that by his own initiative. So like this. And in the mental health week, Superintendent of Police, he conducted sports week in sports parade ground for both patients
Inlet count.
and the
Relatives.
not relatives, staff. So that was another event. It was very grand in the sense these people took march past like athletes, those who were deteriorated and unseeable, they were like athletes. So all these changes is wonderful.
You had a wonderful career. You have achieved, whether it's recognized or not, but in the heart, you have the satisfaction at the end of the day. You did something good to the society. After retirement, how are you spending your time? How is your life, sir?
After retirement from government service, I was working in
After those medical college and all, how is your life now,
So
sir?
I am not practicing. One thing, I used to play tennis and had friends used to meet that and in the club. So spent some time in the club. Then I had work at home. In fact, after retirement, that is after all this, my son and daughter-in-law, they used to go for work. So we had 2 children, grandchildren. So I used to take care of them, take them to various activities like taking them for music, dance, and for sports like this. So on this way, I had I kept myself busy with all this.
So at the end of this show, what would you like to tell this young psychiatrist, budding psychiatrist? Now hundreds of psychiatrists are coming to practice now. What would you like to tell them, sir, before we conclude?
See, as I see now, most of the young psychiatrists, like you and all, they're so dynamic. At all these activities of the
IPS.
IPS, another thing, IPS, I started early. IPS Karnataka chapter started in 68.
You are one of the founder member of that.
Yes, exactly. Myself and Dr. Jairam, Jairam was president, I was secretary. Actually, what made me start the branch was earlier you were made less too available state service. While on the other side, institute people were getting
Yes, sir.
bad salary. This was very, our own students were getting a better pay than we teachers in state service. So I wanted to have a voice to talk to. So when we approached, they used to say something like that as well. So we wanted the organization to be there. So the first meeting itself, that was the one that we discussed. And of course, starting this psychiatry units in general hospitals and colleges were also there. And that's all. And invariably, the other thing I forgot, we used to staff recreation also. Once actually in demand, 2 busload people, of course, including then director Narayan Reddy, we went on a trip to Nagarhode, then Madikeri and all that places. And, when we went to Nagarhode, Dr. Reddy's, another friend, Yellappa Reddy, you might have heard of.
Environmentalist. Environmentalist.
Exactly. He was forest officer there. Then entertainers, he arranged for the tribal dance and all that. It was a nice.
So, thank you very much for being with us. And I guess as a first program organized by Dr. Our Somshekar Bijal, it's an eye opener for many of us. It is not, as you said in the beginning, how many papers we have published or how much money we have earned. What satisfaction we have by developing an institution without expecting any recognition. And it has gone unrecognized, as you said. Though in one decade you could be able to reform a defunct institute into a vibrant institute, and starting diploma course, training courses for nurses, changing the attitude of people in the institute. I guess you are like a one-man army who transformed that institute, and now having a wonderful, relaxed life. And we wish that from on behalf of Indian Psychiatric Society, Karnataka chapter, all the members of Indian Psychiatric Society, we wish to see you as a centenarian. The way you are maintaining your good health, participating in all the activities of Indian Psychiatric Society, be there in the forefront, sitting in the front line, and participating in all the activities. Yes, keep going, and you are an inspiration for us, and you will be an inspiration for the coming generation. And we are extremely thankful for being with us and sparing this evening, sir. I thank you, and we are humbled by your presence on behalf of Indian Psychiatric Society, Karnataka chapter. Last words before I conclude.
Thank you all, and thank the organization for giving me an opportunity to express all this. Thank you very much. Very
Thank
kind
you.
of
Thanks
Very
to all
good.
the participants. Thanks to Indian Psychiatric Society Karnataka branch. I guess we started with a good note today. We had a senior most gentleman, so agile, so crystal clear in his expression, and he himself was an institution by himself. Thank you very much. Thank you. Thanks for giving me an opportunity to interview such a great personality. Thank you very much.
Thank you, sir. Thank you, Dr. VVR, sir, and thank you, Dr. Jagdisha, sir. I was very lucky that I would like to tell one thing that I was a medical superintendent for 2.5, almost 3 years in Demands, Dharwad. I would like to tell to VVR, sir, that the what seeds you have made, it has come fruit. Now the fruits have appeared, sir. Still, what are the legacies you established, like sports meet for the patients as well as the caregivers? The temple is running well. Most of the recreational activities, what you have taught, started, they are still continuing in Demands, Dharwad. And I'm happy to share that we are very much lucky that we have a support from Government of Karnataka, Government of India, and under the NMHP program with the great efforts of Dr. BNG and Dr. D. Nagaraja, we were able to get adequate funds, and with efforts from Dr. Ravish BN, I never forget. So now the institute has become a postgraduate institute in Karnataka with 4 seats in MD and 5 seats each in MPhil seats in psychology as well as the social work, sir. Still the people remember you, most of the staffs remember you, and you might be remembering one old lady who was a air hostess. She remembers you a lot, sir. Still she's there, and still that she's from Maharashtra. Still she's there, and happy. I'm very lucky that I've been blessed by you, sir. So at the parallel hall, the honoring of the Dr. BNG and Dr. SK Chaturvedi, along with our past IPS South Zone President Dr. Swaminath ji is going on, and other past presidents of the IPS South Zone and IPS will be honored after this thing in the other hall. And I am now I for last remarks from the President, sir, Dr. Sripati Bhatt, sir. Concluding remarks. Sir, unmute yourself, sir.
Hello,
Yeah.
Sir.
I am audible.
Yes.
Yeah.
Thank you very much, Dr. Venkatramaya and Dr. Jagdish. You have brought out those aspects of his experiences which are essential for us, all of us, especially the younger generation. Thank you. And of all the things, I think we should thank Dr. R. Venkatramaya, because this meeting was mainly based on your interview and what you share with us. Thank you very much. I thank everyone. And Dr. Bijal.
Yes, sir. Dr. Venkatramaya sir will be honored now in the another hall after this vote of thanksgiving. Now, Dr. Kiran Kumar sir is there? Okay, I am not able to see him.
He must be in the other hall. He must be in the other hall.
Yes, the other function is going on. So it was a very happy moment that the Indian Psychiatric Society on this foundation, on its foundation day, IPS Karnataka chapter has made a significant another historical mark by launching such a beautiful idea, which was by name Revising Revelations in Mental Health, in which stalwarts of the mental health will be sharing their experiences, by which most of the youngsters will learn. And as you all know that from the history, if you look back into the history, we can create our new path. The new path can be towards the betterment of the community, especially the people with a mental ill. The changing guidelines, like it could be a mental health care act or this RPD act, whatever may be there. The new in this new era, if you create more and more awareness, as this first theme, mental health matters, definitely we can reach the people, we can reduce the mental health gap. And I would like to thank our IPS National President, Dr. P.K. Dalal sir, for inaugurating this program and launching this new webinar series of the Indian Psychiatric Society. Thank you, Dr. Dalal sir. I also thank our President-elect in National IPS, Dr. Gautam Sahaji, and our past President, Dr. Ajit Bide sir, and our Indian South Zone President, Dr. Ramakrishnan sir, and our Honorary General Secretary of the Indian Psychiatric Society, Dr. T.S.S. Rao, for blessing us this on this occasion, sir. And I'm very much thankful to our former teacher, my former medical superintendent, uh, whom we are following in the northern part of the Karnataka, his footsteps, especially in the demands. Dr. VVR sir, for joining us today and sharing his experiences. Definitely, we learn a lot from you, sir. Thank you very much for accepting our invitation and taking part in this program, sir. Thank you, VVR sir. Namaskara. Once again, I thank Dr. Jagdisha sir, who has anchored this session very well. Thank you, Jagdisha sir. And I thank all the committee members of this Stalwarts selection committee members for selecting the first great personality, Dr. VVR sir, and also the person who anchoring it. I thank Dr. BNG, Dr. SKC sir, who are present, and I thank all the past presidents of the Indian Psychiatric Society National Branch and past presidents of the South Zone who have participated in person. And Dr. MK sir was supposed to attend it, but due to his inability, he has sent him apologies, and he wished the program a great success. I thank him in absentia, Dr. K. Kalyana Sundaram sir, Dr. Prakash Appaya sir, and Dr. Mohan K. Isaac sir, and Dr. Jagadish sir, the past president, and Dr. Swaminath ji sir is there. He's received, we have honored him. The other people will be honored soon, sir. And other members who are participated virtually, yeah, our token of love and honor will be sent to your house, sir. I thank our president, Dr. Sripati Bhatt sir, for chairing this session and giving his giving his concluding remarks as a president. Thank you, President sir, Dr. President Sripati Bhatt sir. I thank our President-elect Dr. Kiran Kumar. I thank all the support team, especially who in which this idea came, who were coordinated with us in this Telearogya team, and all the EC members of the Indian Psychiatric Society as well as the Indian Psychiatric Society South Zone EC members who have helped me a lot, and also the sponsors of this program, the Micro Labs. I thank one and all those who have participated in person as well as through virtual media, sir. Thank you one and all. With the permission of the President, sir, if he permits, I would like to conclude the program, sir. President, sir.
Yes, yes.
Yes, thank you, sir. The program ends now. Jai Hind, Jai IPSKC. Good night, sir.
Good night.
Yes.
Right. Good night. Thanks.
Good night, sir. Good night, sir.
Good night.
Thank you. Thank you, Ramakrishna, sir. Thank you, Sripati Bhatt, sir.
Good night.
Namaste, sir. Namaste, sir.